Hi, my name is Dr. Jane Wilkinson. I am the GP champion for Sexual Health Wirral. Today I'm just having a little chat around menopause and how that might affect us as women and our colleagues and family members. So often I'm asked, well, why do we have a menopause? Essentially, our ovaries run out of eggs, and in the UK that tends to happen when we're about the age of 51. Around that time, our ovaries start to produce less female hormones, so less estrogen, less progesterone, and for some time, since our 20s really, we have still some testosterone produced, but a lot less. So our bodies become estrogen deficient, and we go through a transition phase when our hormones start changing. The definition of menopause is when you've had no periods for 12 consecutive months. And sometimes we hear the term the perimenopause, and that refers to the time between the onset of symptoms to the actual menopause as I've described. And we're hearing at the moment a lot more about the perimenopause because in the past many women weren't aware that this was a phenomenon. So what kind of symptoms might we expect when we think about the menopause? Well, if you ask women, we tend to know about flushes and sweats because about 80% of women will experience those symptoms. Obviously that then means that 1 in 5 women don't have flushes and sweats. There are many other symptoms that could be associated, and these include physical symptoms like itchy skin, dry skin, palpitations, it could be headaches, it could be joint pains, and that's something that a lot of women tell me that they really weren't expecting when it comes to menopause symptoms. Also in menopause we can get psychological symptoms, so these may include low mood, tearfulness, depression, but anxiety is a common symptom when women present to me in my clinic. Sometimes people feel irritable, they lose interest in things that they've previously enjoyed, and obviously you can imagine the impact that that would have on somebody's life and on their family and friends. In addition then we've got something we call genitourinary symptoms, so these include things like vaginal dryness, vaginal itch, pain, so that's having sex or just pain anyway, bleeding after sex sometimes, although that obviously is something that needs to be looked at, and if you had that you definitely should see a doctor or practice nurse. And also we term it cognitive symptoms, and these are when we may suffer from reduced memory, reduced concentration, and also something around coping. And again, you can imagine the impact that these symptoms might have on a woman and on her life. It is true to say that many women experience a wide range of symptoms, and the British Menopause Society did a survey that the average number of symptoms that a woman experienced was between about 6 and 7. And equally they found that many women have symptoms, but only about half of them actually go and access help. So when we're thinking about menopause, what might we do? If we think that we're having some of the symptoms, you could go online and you could do a symptom score to kind of see where you are, you know, how many symptoms you may be experiencing, and there are various tools that we will put as links to this video so that you can access those symptom scores. So I would suggest that you do a symptom score and see where you feel and do some wider reading, and again we'll put some links there. But then obviously information is one thing, but how actually might I help reduce the impact of these symptoms on my life, you might be thinking. Well, we know that lifestyle change can help, so eating the right foods, looking after ourselves in terms of nutrition, so you might want to reduce sugars in the diet, you might want to ensure that you're having enough energy in terms of protein intake, and you might want to eat healthy fats. We actually need to eat some fat in order to make hormone, including what we have still produced from the ovaries in terms of estrogen, progesterone and testosterone. So we need to eat healthy fats, and that might be in cooking with olive oil, it might be eating avocados, or it might be eating a small amount of nuts. In addition, obviously we want a wide range of fruits, but more so vegetables, and eating what we call eating the rainbow, so eating lots of different colours of vegetables and fruits. And we know that the things that make those fruits and veg colourful are the things that give us what we call phytonutrients, so the good stuff basically. Equally, in terms of reducing symptoms, so we want to reduce alcohol or minimise alcohol, because that can certainly trigger or worsen flushes and sweats. We might want to think about reducing our caffeine intake, because again, not only can obviously it affect sleep quality and duration, but also it may help to trigger sweats. Taking regular exercise is really important, and again can help us manage our symptoms. It may not be that we can reduce those flushes and sweats, but certainly the evidence would suggest that we manage them better. And on the other hand, you may say to me, well, if I've got that long list of symptoms, I just don't feel like doing exercise. So I accept that, but setting small, achievable goals, even if that's walk around the block in the morning or after work or at lunchtime, that at least that's something, and it does help. Equally, in terms of our mental health, we know that exercise helps, and we've talked about those psychological symptoms of menopause that can be very, very impactful to our daily lives, and anything that we can do to help our mental health is also beneficial. And there's evidence to support the use of mindfulness, so having that time out, slowing down and taking time out for self is really important. We know also that for some women, some cognitive behavioural therapy techniques are proven to be useful in the menopause. Again, not necessarily to reduce the amount of symptoms, but it's about how we cope with them when they happen. The obvious solution to an estrogen deficiency, a hormone deficiency, is of course to replace those hormones. And hormone replacement therapy, or HRT, is a very, very effective treatment that for the vast majority of women is a safe option. I am very proactive about managing the menopause, and I feel that our role as clinicians, as healthcare professionals, is to provide information to the women that we see so that you can then choose what's right for you. So essentially, HRT, I'm often asked, well, what is it? If you have a womb, then you need to have not only estrogen replaced, but you also need to have combined HRT, which means the addition of progesterone. HRT comes in tablets, it also comes in patches and gels, and again it's about tailoring the treatment to your own needs. And as a doctor or practice nurse, we'd want to know what's your past medical history, what's your family history, what's your body mass index, do you smoke, things like this, in order to help you to choose the treatment that's right for you. There's a wide range of options, and again it is, as I say, about tailoring that treatment to you and your needs. I'm often asked, well, what about the dangers? What about the risks of HRT? And again, we know that in the media, these risks have often been far overplayed, and it is about offering an evidence-based view. And we will put some resources on the website to guide you, but essentially, as I mentioned before, HRT is a very safe treatment. If you take a tablet for estrogen, then in the first probably up to about the first 12 months, there is a slight increased risk of clotting in the legs that can move to the lungs. However, if you have estrogens via the skin, that's in a patch or gel form, there is no increased risk of clotting nor of stroke, which is why often, we do use these treatments. In terms of progesterone, there are many ways you can have that. Again, it could be in a combined tablet, it may be in a combined patch, or it may be in a separate capsule to take at night, or you may want to choose, for example, a Mirena intrauterine system where you might combine contraception with having womb lining protection as part of HRT. That option obviously also helps with heavy bleeding, which can happen around the menopause, which I think I neglected to mention. Obviously changes in periods is one of the key symptoms as well. So, in terms of breast cancer risk, which again I'm often asked about, you may be surprised to learn that if you're a woman who's had a hysterectomy and therefore can have estrogen only HRT, that actually the risk of breast cancer with treatment is not increased, and in fact there is evidence that it may be slightly decreased if you have an estrogen only HRT. If you have a combined HRT, which you would need to if you have a womb in place, then the increased rates are very slight. You're talking an additional 5 cases per 1,000 women over a 5-year period. So these again are very small increased risks. It is about tailoring to your needs, however, and one of the forms of progesterone we have has some early evidence to say that in the first 5 years of use there are no increased rates of breast cancer, and this is where the tailoring of treatment comes into play. Now obviously we must acknowledge that there are some women who either do not choose to have HRT or can't because of a previous medical history, for example breast cancer survivors. For those women, there are a range of non-hormonal options, ranging from treatments that we sometimes use as antidepressants to some epilepsy treatments that actually have evidence in low dose to be used to help prevent largely flushes and sweats. There are some herbal preparations, for example black cohosh. These have some evidence, again largely around the reduction in flushes and sweats, but can be worth a try. So overall, I think my main messages are that menopause is a significant phase in a woman's life. This isn't a choice, we're all going to have it, and whether we are, in the average age of 51 or whether we're slightly younger, because one thing obviously is that sometimes this happens to younger women. Approximately 1 in 100 women under the age of 40 will have what we call premature ovarian insufficiency, and it's about 1 in 1,000 women who are under 30 years old when this happens. So we must remember that this can happen to younger women. However, there are things that can be done for those younger women. They absolutely should seek treatment to prevent impact on bones and cardiovascular system. But for those of us that are in the more average age range, then definitely we need to look at how this is affecting us and whether or not we want to seek help. And I would urge you to consider that strongly. The benefits far outweigh the negatives for the vast majority of women. So if you're going to be proactive about managing your menopause, you need to know where to go for help. So obviously I'm a GP and I'd be delighted if my patients came to see me in GP surgery about this issue. I'd really be keen to help you. I'm sure that your practice nurses would feel the same way. So what I would suggest that you do is obviously make a routine appointment, but in that time, as we know, there could be a little wait for a routine appointment at the moment. So that's not necessarily a bad thing, because you could spend that time downloading a symptom score, completing that to kind of find out where your symptom pattern is, and also you could do some wider reading, so you could have a look about the risks versus benefits of HRT, as we've been discussing, but also around some of the lifestyle information. And again, we will provide links so that you can have a look at these resources. And I, as a GP, would be absolutely delighted if somebody came to see me, they'd completed the score, they'd done some wider reading, and at that stage then it's more likely that at that first consultation you will go away with your main aim, which is treatment or advice, and have a think yourself about what is my main objective for this consultation? What is the key thing that I want to get out of it? And make sure that you do your preparation work to come away, because the last thing you want is to be sent away to do more reading after having made that appointment. The main thing is, you know, you are not alone. There is lots of help out there.